My brother, who is actually a doctor within the building that she's in, had sent me over to her to help with something that was going on and using an ultrasound technique to help reduce the inflammation. During the exam, we just started talking about a lot of other things, and I saw something here that I had not seen before and a more holistic approach to helping me with some other issues that I had had. I ended up having a full neurological exam, and one of the biggest things that has been plaguing me for probably about 3 years was anxiety, from full-blown panic attacks to just that overwhelming feeling that I had no control of my body or my brain. I was at the edge, and what happened was I had to go to a regular physician because I was waking up in the middle of the night screaming. I had severe anxiety attacks where I wasn't able to breathe or felt I couldn't breathe. I wound up in an emergency room, and everyone would keep telling me, well, you just need to settle down, you just need to settle down, but that's hard to do if you don't have the right tools. So I started on some traditional medicine, such as Paxil and Ativan, but every morning, even though I was starting to feel better physically, I knew that that was just really kind of suppressing what the true problem was, which was my brain and how it was handling it and how it was coming out of my body, whether it was just the craziness that I was experiencing. And through Dr. Dayna, I was able to switch that around and slowly wean myself off of the traditional medicine by using a more holistic approach to things.
When a patient comes in, my goal is to look at them for the individual themselves and try to figure out what areas of the nervous system or what areas of their life may not be working out as well as they think it is. So typically I'll look at life as chemical, physical, or emotional stress. And if we can balance those, or part of them, typically we see a big change within the nervous system itself.
Dr. Dayna's approach to helping and healing is unlike any other doctor that I had come across. I wasn't anxious any longer about having to go to the doctor. I was comfortable about having to come to see her, and that was huge. My time with Dr. Dayna from the very beginning was just this level of comfort with her. She is a kind person, she is smart, she's funny, and she was able to bring all of that into the exam room because you're nervous, especially when you're talking with someone where they're looking at your brain, you know, and she's a chiropractic neurologist, and a lot of people don't even know that that exists. And I have to tell you, they become someone through their education that pretty much knows exactly what's going on because they are so well in tuned with the mind and the body. And with her, there was a comfort right from the very beginning. There was no judgment that I had been on traditional medicine. She allowed me, just through conversation with her, to say I would like to take a more holistic approach to all of this. But through all these different tools and testing that she had me do, we realized that there's something off on this one side, but it's fixable, it's treatable, and through management tools of some of the oils and scents that I use, to some training with my eyes, perception, it's made a world of difference for me.
When looking at the brain, a lot of people think of it as a light switch of being on or off. Really, the nervous system works as a series of dimmer switches, trying to either speed up what's going on in other areas or slow down what's going on. And when you have the nervous system not working and modulating appropriately, then we start to see different signs and symptoms. It could range from cognitive changes with, dyslexia or problems with learning in school, or it could be something as common as anxiety or dizziness. So when assessing each patient, my goal is to figure out which areas of the nervous system are not doing its job, whether it's to slow down the system or to speed up the system. And our therapies are then tailored to those specific areas in order to help treat part of the system that's not developing, as opposed to treating the whole system, which, only part of it is malfunctioning.
How she explained to me what was going on inside my brain compared to some of the other doctors that I had talked to. It made me feel like I wasn't crazy for the first time, and that I just wasn't given a pill and said, here, this is going to make it better, and there was a reason I was feeling the way I was feeling. And again, it goes back to how strong the brain is and how everything that is happening to you physically is tied in with it. And I was able to, for the first time, to say, I'm going to be okay. And I really just need these tools to continue to keep them going in my life, and that's what's changed everything for me. The vast improvement has been in my relationship with both my domestic partner, which I like to call him, and with my son and my stepdaughter. It was, I was the one that everyone was avoiding in the house because I was never felt like I was in control of anything. And that affected the entire home. And there was a level of stress that was really being brought on how I was, from how I was feeling. And there's a brightness again in my eyes. There, physically, I feel like I can conquer the world again. I'm not just crawling into bed in the middle of the afternoon and going to sleep. I have energy that sustains me throughout the day. And combining that with the approaches that she gave me and good nutrition and exercise, I feel like I'm the Sally that I used to be.